Respiratory illness and controlling outbreaks has been a focus of the military for centuries.
Just as you don't want someone overtraining and developing musculoskeletal problems, you don't want someone experiencing infectious diseases.
Once an outbreak takes hold within the military setting, where troops are in close quarters, they travel together, they live together, and they live in difficult conditions that's hard on their immune system, it can wipe out huge numbers of troops and really remove them from their ability to fight.
The adenovirus was discovered in the 50s, and people began to look at the possibility that the adenoviruses were responsible for respiratory disease in military training centers. And what they found was not only was it was responsible for most of it.
Adenovirus is a very common virus. It often causes cold-like symptoms. Everyone has had it at least once in their life. But when you create conditions of hardship, if you are a military member in barracks, for example, living in close quarters, living in difficult conditions, sometimes adenovirus can be quite a bit worse.
The military is really the perfect storm for this.
Within a couple weeks of being there, they would develop respiratory symptoms, fever, cough, sore throat.
It resulted in infections in probably 80% of the young recruits coming into the military, and about 20% of these people were hospitalized.
Not only were those new recruits unable to train, often they missed so much training they had to restart.
So it interfered greatly with the lives of these young trainees who wanted to get through training and complete it.
Sometimes so many people fell ill when the outbreak took hold that they overwhelmed the local hospital and had to set up makeshift treatment facilities.
It puts a lot of pressure on the medical care system.
Panic came in before the vaccine was invented, when there were these enormous outbreaks that would really disrupt the functioning of the military, and leaders really understood the importance of finding effective control.
You want them healthy on the job. So anything that detracts from that state of health, from that ability to perform at their highest level, is of concern to the military.
They invented a vaccine, they got it out to the troops, and they were rewarded with years of nearly perfect control. There were no deaths and very few outbreaks.
I have a great respect for young people who volunteer for the military, put on the uniform, and subject themselves to very rigorous training, a lot of pressure, and being transported all places over the world, and actually putting themselves in harm's way for their country. And I think that we all have an obligation to do everything we can to make life easier for those people.